HER2 low breast cancer, I do think though bears mentioning because it's a new and very excitingly newly actionable subtype of breast cancer. You can see HER2 low breast cancer, which is represented in the orange pie slice here, is not a small proportion of breast cancer. It's actually half or a little bit more than half of breast cancers overall. And so these are defined as breast cancers that are not HER2 positive, but are HER2 low by virtue of being IHC 1+ or 2+ with a negative FISH test or ISH test. So an IHC 0 tumor would be truly HER2 negative, an IHC 3+ or FISH positive tumor would be HER2 positive, and anybody in the middle, which is more than 50% of cases, is HER2 low. And the reason that this new category matters is because of the Destiny Breast 04 trial, which was a plenary presentation at ASCO this year and then just published in the New England Journal, which showed that in metastatic HER2 low breast cancer, T-DXd did better than investigators' choice chemotherapy. And so you can see those survival, the PFS curves here, where the blue line shows that patients who were receiving T-DXd had in the top a PFS of 10.1 months versus 5.4 months for hormone receptor positive HER2 low patients, and in the bottom curve 9.9 versus 5.1 months for all patients, hormone receptor positive and triple negative. Of note, you can see on the left here, most of the patients in this trial were hormone receptor positive, but a few triple negative patients were represented. The most common chemo that was chosen by the investigators was eribulin. And just to also point out, there was an overall survival benefit that was also seen in the hormone receptor positive in the overall population. So an impressive result for this agent, even in patients who we don't consider HER2 positive, presumably because of that bystander effect, where the T-DXd payload can diffuse into nearby, can diffuse among cells that are not particularly strongly HER2 positive. There are a lot of outstanding questions in HER2 low breast cancer, like how do we sequence T-DXd with other treatment options? When do we test the HER2 status? Do we need to retest it over time longitudinally? And what assay should we be using now to measure HER2 low status, since our current assays really were just designed to tell us who's HER2 positive, not who falls in this sort of HER2 low category.